So you could put all these great things on your skin. If it just sits on top of your skin, it does nothing. One prime example of that is application of hyaluronic acid on the skin. To me, that's a fad. It's never too early to start taking care of yourself. Your parents should be taking care of you,
yes.
right? I'm a big proponent of Botox. Like I said, I do my own Botox injections regularly to myself in the mirror every 3 months.
Oh, wow.
So I'm a big fan of that.
Dr. Cameron Rokhsar is a double board-certified dermatologist and dermatologic surgeon known for his work at Mount Sinai. He pioneered non-surgical rhinoplasty and helped develop the Fraxel laser. He completed his medical training at NYU and has offices in Manhattan and Long Island. His expertise in cosmetic and laser procedures is widely recognized. And today we have a chance to talk to him and learn more about men and men's skincare. Welcome to our studio.
Thanks for having me. Glad to be here with you.
Thank you. So we'll get into the first question. So what is the biggest mistake you see men make with their skin? Why do they wait until they're 40 to do something about their skin?
That's a really good point. Men are definitely not as proactive as women are in terms of taking care of the skin. I think men have more of a mentality that don't fix it till it's broken kind of thing, whereas as women are really proactive about everything. And that's not just in skincare or dermatology, even in just general healthcare. We know that trend that women are much more proactive in terms of getting the annual with their medical doctor, the annual skin checks, but kind of men kind of wait until something goes wrong. And that's just, I think, one of the basic differences in the sexes.
And what about this whole rumor that men's skin is thicker than women and they lose collagen as they get to 25 and then they lose a lot of skin until they see that deep, fine wrinkles show up? Is that any merit to it?
Well, I think that men probably have thicker skin, but I think also the thickness of skin is based on race. So we definitely know races that just have thicker skin and races that have thinner skin. It also depends on anatomic area, right? So, for example, your eyelid skin is always going to be thinner than, let's say, the skin of your face. The forehead is also, it has thinner skin. But also in terms of races, for example, Asian skin, East Asian skin, they usually have thicker skin. White Europeans have thinner skin. But also thickness depends on age and environmental exposures. We know sun damage thins out your skin because sun erodes the basement membrane proteins that give structural integrity to the skin, like collagen and elastin and these types of proteins.
And so what can men start to do better to take care of themselves earlier on?
That really then becomes a lifestyle. What kind of lifestyles you choose. So we know certain environmental factors that cause premature aging, right? The number one being sun exposure, which I just alluded to, because we know that ultraviolet radiation breaks down these basement membrane proteins that I talked about, collagen, elastin tissue, things that give structure to the skin, that give elasticity to the skin. So that's a no-no. Wearing sunblock on a regular basis definitely prevents premature aging. Other lifestyle choices, there is now 40, 50 years of science behind the fact that smoking causes premature aging. We know smoking has a lot of health issues associated with it, including premature cardiovascular disease, risk of stroke, high blood pressure, cancer. We all know all that. But the thing that's often forgotten is that smoking causes premature wrinkling. It's because smoking not only clogs all the arteries to your vital organs, like your heart, like your brain, causing heart attacks and strokes, but it also blocks nutrition through blood supply to the skin.
Right.
And so when you don't get proper nutrition to your skin, you get premature aging. The third factor has to do with lifestyle choices in terms of healthy eating and exercise. So we know that regular exercise not only does keep your body healthy, keeps your mind fit, but also keeps your skin healthy. There's actually been a lot of research in the past 5 years that's elucidated that part of aging may be related to muscle mass.
Right.
It's something that's really interesting, and we're trying to, we're at the beginning of discovery what the physiology of that is. There's something about pure muscle mass that prevents aging. There's something about, just having more pounds of muscle. And so actually weightlifting and resistance training has been associated with reducing the aging process. And this is all really interesting stuff. And obviously, a healthy diet always is very important. Not eating processed foods, not consuming foods with a high glycemic index,
right.
High protein, a diet in fruits and vegetables with antioxidants. So, we can really be in control of a lot of things that we do to maintain healthy skin.
So, you bring up a great point about lifestyle, and I really want to touch upon what we do in New York, right? We both live here, and I see a lot of alcohol consumption. And it's so easy after work. It's much easier to go grab a drink. One drink turns into 3, and in a week, you've already had 20 drinks. So how does alcohol affect?
I don't think there are any studies that have really looked into this, but I think it's a question that really begs some scientific research. Mm-hmm. We know that in the past 5 years, there's a lot of new studies that have come out that have pointed to the toxic effects of alcohol on the body, right? The old motto was, 1 or 2 drinks a day maybe even keeps the doctor away, But that whole paradigm is coming into question. Is that really true?
Okay.
So a lot of new research is elucidating that even maybe 1 alcohol a day is bad for you. For many organ systems, that really alcohol is poison, that it causes toxicity. I mean, a lot of these studies are around organ systems like, liver and stomach and their association with, hepatitis, colon cancer, stomach cancer. But it remains to be seen really what is the true effect of alcohol on premature aging and skin wrinkles. And I think that once we really find out the full story, it can be too good.
Right. And so let me go back to that first question that I asked you, right? So I talked about men in their 40s because those are the men that I see coming and asking the questions of what to use, when to start, because I think they see their first wrinkle and freak out. But if I were to ask you, what is the age that they should start taking care of themselves? And I've always said, if you don't take care of yourself in your 20s, the, sins of your 20s show up in your 30s, the sins of your 40s show up in your 50s. But I don't know if there's any merit to what I'm saying.
There's absolutely 100% merit to what you're saying. It's never too early to start taking care of yourself. I actually kind of will take the question to earlier stages of as you should be taking care of yourself as a child. Your parents should be taking care of you,
yes.
Right? Because let's go back to the basics of skin cancer, for example. We know that 3 episodes of a bad burn during childhood increases the risk of skin cancer when you're an adult tremendously.
A sunburn?
Sunburns.
Oh, wow.
Right? So that's been shown. Those studies are well established. So, it's not, I think 20s may be too late. Really, good skincare starts with your parents teaching you good skincare techniques, sun avoidance, wearing sunblock, avoiding peak hours of the sun, just for skin cancer prevention purposes. But as you said, so, during teenage years, I think our skin has different needs. So you have to take care of it differently. I see a lot of teenagers with, bad skin.
Yes.
Right? So teenagers have, whether it's men or women, hormones during teenage years causes a surge. Surge of testosterone causes acne breakouts, right? Because we know the sebaceous gland in the skin is under the control of testosterone, right? So that's why during puberty people break out. So your skincare needs as puberty is different. You need to make sure you're not using oily products, for example, because that clogs your pores. The cleansers they use during teenagers is different, right? You may want to use harsh cleansers to decrease your oiliness, for example. But that changes as you get older. So your 20s now, things are going to be different. You're going to be more interested in, wearing your sunblock, but also, wearing good moisturizers to keep your skin hydrated. Whereas during teenagers, your skin may be too oily. That changes, right? Then you get into the whole preventing dynamic wrinkles so that they don't become static wrinkles, right? So, we divide the wrinkling process into two categories as dynamic and static. Dynamic wrinkles are created by muscle movements, right? So when you're moving your muscles, as time goes on, those repeated motions of muscle movement carve or etch those motions into your skin, right? So then in your 20s, you may want to start thinking about preventative Botox, right? Because we know Botox prevents dynamic wrinkles, but it also prevents those lines being etched into your skin. So people talk about Botox. Well, is Botox something you do in your later years? No, I think if you want to do prevention, I'm a big believer that men in their 20s should be doing Botox for prevention. I've been doing it since an early age. And so I think I don't have many wrinkles. I'm not going to tell you how old I am, but I think, I do my Botox regularly, and I'm a big believer that it prevents, wrinkle formation. In your 30s and 40s, then you become more proactive about what else can you do. Then the whole idea of lasers and fillers come in, right? So if lines are already getting etched into your skin, there are laser resurfacing procedures we can do, Fraxel, CO2. Then more deeper volume loss that happens in your 40s. You become sunken looking.
Yep.
Your under eyes become hollow. Then we can address those through use of fillers. So you're absolutely right that, prevention of things starts early on, but your needs of your skin change through different decades of your life.
Yeah. And I see a lot of men with adult acne scars, right? So deep scarring that just doesn't go away. And I know that I've seen content from you that shows the surgery that helps remove this, whether it's laser, I call it laser surgery, but the point being that there is something that they can do about it.
Acne scars is a very, very common problem. Men are very much bothered by either acne scars. In early teenage years, a lot of, young boys don't care about their skin, but then they see the side effects of it as they get older, and I think a lot of them regret that.
Yeah.
So a very important thing for teenagers is to try to prevent acne, right? Because severe inflammation from acne, cystic acne, it degrades, again, those basement membrane proteins that I talked about, collagen, elastic tissue. So it causes depressions in your skin, right? That's the definition of a scar is, textural changes in collagen that causes depressions in the skin. Once that happens, the problem is harder to fix, right? So as you mentioned, we do have great procedures for it that, have been around now for 20, 25 years now. We do laser resurfacing for acne scars, things like Fraxel, things like CO2 that help skin remodel. They stimulate skin to grow new collagen. There are other more invasive things you can do. For example, to break up scar tissue, I do something called subcision, where I go inside and I try to free up the scar tissue from the underlying structures. There are fillers you can do for scars now. We have various fillers that are very helpful. Sometimes in worst case scenario, when scars are very deep, we have to cut scars out, surgically, and then, and then laser them down the road. So luckily, I think, our understanding of scars has come a long way in the past 20 years in dermatology, and we do have a lot of solutions for scars.
And this can be done at any age. A man in his 40s can come to you and say, Dr. Cameron, help me with this. Is that okay?
Absolutely, yeah. I mean, look, people seek help with their scars at different stages. I mean, I have teenagers that come in for scars, who want to, fix their scars, men in their 20s, 30s, 40s. Look, I have 50 and 60-year-old men that all of a sudden are bothered by this scars.
Yes.
And, these are people that potentially maybe 20, 30 years ago, there wasn't much that doctors could offer them.
Right.
But now that they realize that science has advanced so much in this field that, we do have great procedures that can help them with their scarring.
And so if you're a busy professional, what's the downtime like? How many times do they have to come, and how much time do they have to take off?
Scarring, it depends on what we do, right? So for example, gentle laser resurfacing like Fraxel has just a few days of social downtime, a few days of redness, and maybe peeling. If you do something more aggressive like the CO2 laser, that's got a real 1 week downtime. Things like subcision, where we're actually kind of freeing up scar tissue from inside out, that can have a week or two downtime. Fillers have no downtime really. So if somebody wants a quick fix because they're busy professionals, we can quickly put fillers and make people look better. This is a very common procedure I do, especially for people who are trying to get ready for an occasion, whether it's their wedding, Whether it's a big professional thing that's coming up, they want to look quickly better. So people can come to fillers and be ready in a week, for whatever event they have. So, we have a range of options with a range of kind of downtime, and we can cater that to the person's needs.
So what do? They just say, okay, I'm going to find the hottest dermatologist in town, call you up, make an appointment, and then they show up, and then you give them recommendations?
Yeah, patients have become very savvy in terms of research. Sometimes it's a good thing, sometimes it's a bad thing, because sometimes over-researching things kind of...
ChatGPT for the...
Right, leads you to the wrong thing. I actually do like AI. I think that things like ChatGPT and other things actually give patients good advice in terms of where to start. But I also do think that sometimes patients get carried away with too much research, and over-researching kind of pigeonholes you into you thinking that procedure is it. That's the only thing you have to do, and it closes off the range of options that a doctor can offer you. So I spend a lot of my time educating patients that, there's a lot more that we can do, and there's different ways we can think about things besides pigeonholing into one thing.
Yeah.
But in general, I do think that the fact that people have a lot of research readily available to them at least gets them in the door to think about things the right way.
I want to take a step back and talk about simpler things that you can do every day. So in my experience, I started using true skincare only 5 years ago, right?
Maybe you had perfect skin. You didn't need it.
We all have our flaws. And so once I started using these products from Paris, and I realized that instead of the noise that I was hearing, right? Because again, I work in tech and I'm surrounded by men, so I think like a man. I'm very simplified and very precise about what I use. And the two ingredients that truly helped me were retinol and vitamin C. And
that's right on.
Right?
Yeah.
And what is that? What is retinol? Who should be using it? Why should they be using it?
So the retin-A molecule, retinoin, which started the whole thing. There's probably more than 50 years of science behind it. Incidentally, there's an oral drug with a retinoid, and that's Accutane, which everybody's heard of. Accutane helps acne. That's a retinoid also. That's an oral retinoid. So we have retinoids available orally and topically. So topically, it's retin-A and things of that sort. There's many forms of retinoids available. But the way retinoid or retin-A, prescription retin-A works is it works in terms of skin turnover. So skin is able to turn itself over more efficiently, and that's how it helps acne. But also, there's a lot of science that shows that it causes collagen remodeling, that it actually boosts collagen production, right? And so retinols are gentler retinoids that are over the counter, retin-A or tretinoin being prescription, other prescription retinoids being tazarotene and adapalene. By the way, but some of the prescription retinoids now are becoming available OTC, like adapalene. You can actually get a low percentage of adapalene over the counter. But getting back to retinols are more gentler. They're gentler, more tolerable retinoids that are available over the counter. And again, their important role is in boosting collagen production, potentially helping fine lines, helping acne or pores. If your pores are getting clogged up, retinols are very important in terms of unclogging your pores and just giving you smoother texture. Vitamin C also has probably about 30 years of research behind it, solid research. Vitamin C is an antioxidant. We all know that. I guess people take it orally for immune system, an immune boost. But topical versions of vitamin C have been shown to have antioxidant effects in the skin. And they have benefits for fine lines, but also skin texture and also skin color. So vitamin C has been shown to have actually brightening effects on the skin for improving color.
So I am a 40-year-old man, okay, and I listen to this podcast, and now I'm ready for starting my skincare. So can you give me 3-4 things I should be doing? Obviously, I don't have the time or the consistency to keep up with everything. What do you think I should be using?
Number one, sunblock. We talked about that, right? So sunblock should be incorporated into your lifestyle.
Yeah.
And one important misconception about use of sunblock by not just men, by many people, is that you use your sunblock in the morning and it's going to protect you all day. We know that's not true.
Yeah.
Because sunblock lasts probably 1 to 2 hours. Maybe a sport version of it lasts a little longer because they're greasier, but most people don't want to use sport versions on a daily basis. Maybe they'll use that on the beach when they're going to water. So regular sunblock is very important. Using sunblock on forgotten areas of the face, right? A lot of people forget their ears.
Oh, that's true.
Yeah, for men,
Yeah.
They forget their lips,
Mm-hmm.
right? Men also forget their scalp, especially men with sparse hair.
Right.
That's also an important reminder because skin cancer happens in those areas a lot commonly, but people forget to use sunblock. Second thing is regular use of a retinoid, whether it's retinol over the counter or whether it's a prescription retinoid, I think helps general skin health in terms of unclogged pores, fine lines, texture, some skin color. The third thing would be topical vitamin C, like you mentioned. I think, that's a very important part of the skincare routine, especially in the mornings. I like vitamin C serums in the mornings and the retinol at night. And then number 4, then it's a toss-up in terms of, there is a lot out there. So I would say number 4 is a toss-up between peptides, biopeptides. There's, a lot of buzz about that in the past 5 to 10 years. And probably the past 10 to 15 years, there's a lot of buzz about growth factors. So I think, one can choose from one of those categories of topical creams.
And what do? They strengthen your skin barrier?
So, it's a very complicated subject. Peptides are a sequence of proteins, right? It's short-chain proteins and a bunch of amino acids. And different peptides can potentially have different effects on the skin. And, we can make 1 billion types of peptides.
Right.
The range is wide because you can have different variations of amino acids linked together and make that. So the science is early, but different peptides have really been shown to improve, again, fine lines, texture, color. And, I don't want to get into promoting a certain peptide because there's a million companies promoting their own product.
Right.
Unfortunately, there's no one way to research all these against each other. And, it's kind of like the Wild Wild West.
Yeah.
But I think that people should look into the category of peptides as a viable option to improve your skin health. Growth factors have been around for more than 20, 25 years, and usually growth factors are derived from a skin cell line. One of the first companies that didn't get that one mentioned, but they used human foreskin. They created a cell line that propagated from human foreskin, and then they basically grow these cells in culture, and then these cells secrete nutrients called growth factors. And then so these companies basically are packaging these growth factors into products. Now there are companies that have made it from human foreskin. There are companies that have made it from other areas, fetal skin. Anyway, but there is some role behind growth factors as truly products that have scientific backing in terms of skin health and skin regeneration.
I hear a lot about exosomes now. Can you talk a little bit about that?
The whole field of exosomes is very new. Scientifically, exosomes are out pockets of a cell that carry certain messages in that out pocket, and they take off from the cell and they're able to integrate into another cell easier. That's how it works, right? Exosomes. The question is, what is in the exosome and what effect it's going to have? And again, it's at its infancy. Unfortunately, I think that a lot of companies are making grandiose claims that are not substantiated.
Mm-hmm.
So I think we need a lot more kind of research and regulation in this field. Exosomes are currently only FDA approved in the United States as a cosmeceutical.
Mm-hmm.
That means they should only be applied to intact skin, not broken skin. There's a lot of people in my field that are injecting exosomes. I want to warn the audience against that. I'm 100% against that. Exosomes do not have FDA approval right now for injections or for application to broken skin, like microneedled skin or laser skin, because none of them have truly sterility approval.
Mm-hmm.
So they should not be injected. But I know there's a lot of that going on in the United States and abroad. But public should beware?
I agree with the warning because I think there's a lot of recklessness when it comes to this kind of thing, especially for women because we're willing to try anything.
Women are definitely more experimental.
Yes. So,
And they also like to go with fads a lot more.
that's right. But we're also like bringing the cutting edge.
That is true.
Yeah.
That is true.
I was in Korea recently, and there is a dermatological clinic every corner of the street in Gangnam. And they do, encourage you to use exosomes and everything with the microneedling. I tried microneedling, but I stayed away from the exosomes because, again, I'm vegetarian. So I was like, I'm not sure what this extract is. But the process itself of microneedling, I felt like it had tremendous effects.
I think microneedling is really nice. We talked about Fraxel. Fraxel, what it does is it's putting microscopic arrays of laser damage in your skin, and they go to a certain depth, and the body sees these layers as dead skin and tries to replace them with new skin. Microneedling is doing that with needles, right? So it's a mechanical trauma that the little needle go into your skin. They're causing mechanical trauma in your skin, so the body sees that as injured skin and it tries to replace it. So the theory is the same. One is doing it with laser, beam of light. The other one's doing it through mechanical needles, right? So I do believe microneedling is a great procedure. And now a third thing that's been around the past 10, 15 years is RF microneedling.
That's right.
So now they've added radio frequency to the needles. So not only the needle is mechanical, but it emits radio frequency energy, which gets converted to heat in your skin. So now you have mechanical plus thermal effects to contract your skin. Getting back to your wise decision not to apply the exosome is because when you did your microneedling, your skin is open now, right? So you have all these open channels. You may be a little bit even bloody. You may be a little oozy. Usually your skin heals within 24 hours. It closes. But during those 24 hours, exosomes should not be applied, in my opinion. I'm not saying that, the exosome may not have beneficial effects. The problem is that right now, none of the exosome preparations in the United States are FDA approved for sterility for application on raw skin.
That makes sense.
So you can potentially get infection from it.
Right. And, going back to the skincare and skin routines itself, in preparation for this podcast, I was asking some of my male friends, hey, what do you want me to ask Dr. Rokhsar? What are your complaint areas, right? And we did a survey. And the top 3 reasons were, one was they want to look good, well kept, whatever that meant, right? Just grooming. 2 was that they had problem areas, blackheads, whiteheads, and the 3rd was wrinkles, right? It was wrinkles everywhere, under eye, because everyone is staring at a phone or a computer all day long. And so these were the top 3 reasons. So I wanted to kind of just address each one of those, right? So the first one for grooming, I think we've touched upon various things that they could be doing. Should people be doing facials? How harmful are they? How good are they? What is the routine? How many times should they do it?
I think facials are great. I'm a fan of facials, right? So I think facials can serve your skin in many different ways. Number one, you mentioned blackheads. So what are blackheads and whiteheads? Let's actually talk about that.
Yeah, let's talk about that.
So blackheads and whiteheads are really your pores that get clogged up. What are your pores? Pores are hair follicles. So when people talk about pores, we all have hair follicles all over our skin. Some of them are very small and miniature, microscopic. You may not see it. In men, obviously, they're bigger because we have a lot of hair coming. Women also have pores, right? Now, people also talk about pore size, by the way, which we should talk about because that's a very common thing that people talk about, right? So what is pore size? Pore size is the size of your hair follicle. Now, in some people, genetically, their pores are bigger. And in some people, their pores are smaller. And those who have porcelain skin, right? So that's part of that is genetic. Part of it is age. It just so happens that our pore size grows with age. So babies all have smooth skin, right? You don't see babies with like big pores ever, right? What is it? Their hair follicles are small. And then genetic programming kicks in as you get older. And, I always say we're a genetic blueprint of our parents. Everything that's supposed to happen to us in life, a lot of it happens because of that genetic blueprint, because our DNA is programmed to make certain things happen in our life at different ages.
But are we doomed if we don't have those great genetics?
Well, we're not, because I'll talk about pore size and facials and things like that, but there are things we can do. Obviously, your lifestyle has something to do with it in terms of improving things, so we're not doomed 100% by our genes. We can help things along. But when we talked about blackheads and whiteheads, again, going back to that, these are pores that get clogged. A whitehead, as what it says, it looks white on top. It's a keratin plug. Our skin produces a protein called keratin. And that when that keratin sits on top of the hair follicle, at first it's white, but then it gets oxidized with time and it becomes black. Right? So that's what blackheads and whiteheads is. I'm just trying to demystify this for the audience, right? And so people's pores do get clogged up more as they hit puberty, because pores and keratinization is also under hormonal control, right? So one of the great benefits of retinoids is that it helps the way the skin turns over, and so it helps pores remain unclogged because of skin turnover. But facials also do this mechanically. So in a facial, your esthetician is kind of cleaning your face with various products, whether that could be glycolic acid, which again helps unclog your pores because it's an acid. Whether they're doing a hydrofacial, let's say, there are machines now to do facials that esthetician uses that are more scientific. And I'm actually a big fan of the hydrofacial. Hydrofacial uses kind of patent technology where they have different chemicals like glycolic acid, like retinoids, like vitamin C. They infuse that into your skin, and they can also suction things out. So they can infuse glycolic acid and suction it all out. So it gets rid of dirt on your skin, gets rid of blackheads, whiteheads. It cleans your pores. It gets rid of dead skin. So it makes you have a more vibrant look. So, facials, facials are very helpful, in my opinion, in terms of unclogging your pores. And maybe by infusing some of these active ingredients into your skin, which the hydrofacial can, like vitamin C, like retinols, like other boosters, you can actually help fine lines and things like that too long term. Because, one of the important barriers that we have in terms of application of skincare topically doesn't work as well as maybe it should scientifically. A lot of that has to do with absorption. So you could put all these great things on your skin. If it just sits on top of your skin, it does nothing. It's just, making you psychologically, happier. But it's not really doing anything, right?
Yeah.
One prime example of that is application of hyaluronic acid on the skin.
Yeah.
Right? To me, that's a fad. Hyaluronic acid is great, right? It's part of our skin. It's part of our joints. It's a great lubricant. And technically, if that hyaluronic acid that puts you on the skin got inside your skin by passing the skin barrier, it'd be great. But it doesn't. The molecule is too large.
Yeah.
So part of the science of skincare is also not the active ingredients, but figuring out a way to be able to get the active ingredients bypass to the skin barrier, right? And so that's a very important point. So now I'll just segue into fillers. We figured out a way to bypass the skin barrier for hyaluronic acid. What is it? It's injection of hyaluronic acid into your skin.
Right.
This whole thing makes sense. If hyaluronic acid just got into your skin by you applying it, the whole field of fillers would disappear.
Yeah.
You wouldn't need it.
Right.
Right? But we know it doesn't pass through. Most of the fillers that we have that we use for plumbing, wrinkle reduction, volume augmentation, they're all hyaluronic acid. They're just different versions of hyaluronic acid cross-linked, make it thicker, and so on. So we inject it for skin texture, for fine lines, for deeper lines, for volume augmentation. And so that's why they have a role.
So, doctor, you freely use these words, glycolic acid and hyaluronic acid. Weren't we taught as kids that acid is something that burns your skin? How are we so comfortable with these things now?
Okay, that's an interesting question. So definitely that goes back to chemistry, right? What is an acid? The definition of the acid has to do with pH. So I don't know if I want to get into chemistry, but we have neutral pH, like neutral pH is pH 7. And we have basic and acidic, right? And basic is above 7. Acidic is below 7, right? So acidity doesn't have to be extremely harsh. It could be mild. An example of something acidic that you use every day is lime.
Lemon. Yeah, citric acid.
Citric acid.
Yeah.
It's an acid.
Right.
But you ingest it.
Right.
It's perfectly safe.
Okay, good.
Okay?
Yeah.
So that's a nice acid, right? But so the word acid by itself is not a bad thing, right? It just means that the pH is below 7.
Right. Okay.
Now, we can have a lot of different things of acid
Right.
in it, like citric acid, glycolic acid, we have lactic acid. Lactic acid is found in
Milk.
milk.
Right.
You drink it every day.
Yeah. Okay. Great.
Right?
Yeah.
So, yeah, we got to put that in perspective. Obviously, Clorox is acidic, so you don't want to put that in your skin, hypochlorous acid. It's
Right.
called hypochlorous acid.
Yeah.
Right? So if you use acid that's extremely acidic, it can cause burns,
Right.
chemical burns. But, the preparations that we use these are medical grade. For example, you mentioned glycolic acid. We have different percentage of glycolic acid, right? And the percentage matters. There, 5-10% glycolic acid is approved for use in topical products. You can buy it over the counter, and it's perfectly safe.
The AHA, BHAs that we
Yeah,
right?
alpha hydroxy acid, beta hydroxy acids, right? But then when you get to higher concentrations, they're used as peels in a doctor's office, right? So above 20% becomes a peel. That's not meant to be used for daily application at home. So you can go 20%, 30%, 40%, 50% glycolic acid in a doctor's office, depending how deep of a peel you want.
So one of the things that I've introduced into my skincare routine is to do exfoliation once a week, just because going back to what you said, which is better absorption of products, but also like I look better when I do it. So is that something that you would advise?
I do.
Yeah.
I do. And I think you're using the sweet spot for exfoliation, because there is such a thing as over-exfoliation.
Okay.
And there's such a thing as under-exfoliation.
Okay.
Right? So when you're under-exfoliating, what's happening? Everything is just building up on your skin, right? You have dead skin that builds up. The name of dead skin is stratum corneum. If we have a layer of dead skin, it's called stratum corneum. Sits on top of your skin. It just builds up and builds up and builds up. And then it gives you a dull look. Then for women who are putting makeup on products, stuff gets in and you can't fully get it out. Then you've got blackheads and whiteheads that build up. Keratin builds up, which is the protein that we talked about. So exfoliating once a week is actually a sweet spot to kind of get rid of all that. Now, if you over-exfoliate, what happens? You're breaking down the skin barrier. That's not good. Why? You lose moisture in your skin. Your skin becomes dry, cracked, irritated. And so that backfires on you. So people ask me about products that have beads in them, those kind of exfoliating products.
Yeah.
And so they're good as long as you don't overuse it.
Okay.
Yeah, right? So it's good to use it like once a week for kind of cleaning and helping the dead skin peel off and getting your skin to become more brighter, but don't overdo that.
I stopped using it because they said it puts fine lines on your face. I stopped using that.
Again, I don't believe that. I believe that being too harsh with your skin and breaking the skin barrier can do that. So overuse of that, daily use or every other day, it's too much. But if you're using it once a week, once every 2 weeks, I think that's a sweet spot for those things also. And I think that has more of a role as you in aging than in younger skin. I think people with younger skin don't necessarily need that, but I do think that as we age, like exfoliating with one of those kind of cleansers is okay once a week or once every 2 weeks.
Amazing. I do want to talk about supplements. I truly believe that good skincare, is one part of the equation. Skin reflects your health, right? How healthy are you today is shown in the way that you've slept, you've eaten well, and you've exercised well and all of that. But can we help ourselves with oral supplementation or IV lines and so on? There's such a trend right now.
Yeah, so for me, that's a very controversial view.
Okay.
I'm a minimalist, just by nature. I'm a big believer that nature gives us all the nutrients that we need and we should get it naturally. That's my personal belief. So I'm not a huge supplement person.
Okay.
And I'm a big believer that you want to get your vitamin C, you're better off getting it from fresh squeezed orange juice and lime and not from a tablet.
Yeah.
We know that that's scientifically true.
Yeah.
Because the natural stuff that you get gets absorbed better in your by your body. We know that if you take a multivitamin, you take it on an empty stomach, 90% of it goes through your poop. Like it doesn't get even absorbed. So that just shows you our body is very smart.
That's true.
Our body doesn't want unnatural things in it. It extrudes a lot of things. So in my opinion, you want a multivitamin, go juice a bunch of fruits and vegetables and have a juice every day of fresh fruits and vegetables. You're going to get all your multivitamins and antioxidants from that, and you don't need a pill. And it probably gets absorbed better. It tastes better. The problem also with the vitamin and supplement industry, in my opinion, is a huge problem. It's an unregulated industry.
Unregulated, yep.
So most people don't know this, but whatever you think of our FDA, I mean, some people like to just cast the FDA in a negative light. But the purpose of our FDA is to keep our food and our drug industry honest and safe. And they've done that successfully throughout history by keeping many, many things out that do harm to us. Sometimes they failed by approving a drug that they didn't, vet properly. But that's their job. And many people don't know this, but the FDA has the authority to do spot checks on drug companies and their manufacturing processes and their factories. And they're allowed and mandated to do that all over the world, not just the United States, because we know a lot of drug companies have their factories outside the United States. There are, believe it or not, FDA agents that ride on motorcycles in dirt roads of India and Thailand, and they do spot checks on factories.
Yeah.
And they shut down factories. They can shut down a factory immediately if they see something is wrong.
Shout out to the FDA.
So I go on this tangent because I want to tell you this process of checks and balances is not present right now on the vitamin and supplement industry.
Why is that?
I just think it's lack of resources. The FDA has to pick for them, it's more important for them to look at our food industry and look at our drug industry to make sure that nothing really bad gets through. You can't check everything. And the vitamin supplement industry is so vast. So unfortunately, I think you can start a vitamin supplement industry and the FDA will have very little say in terms of what you're claiming. You can claim whatever you want. You could put whatever you want. And if you don't believe what I say, anybody can go Google this article that appeared in the New York Times about 20 years ago. It was maybe a 30, 40-page expose investigative article on the vitamin supplement industry. And what they did was they did DNA footprinting studies, and they checked a bunch of brands, like 20, 30 brands. And they wanted to know first if their claims were valid about what they have and what their active ingredients were. Shockingly, 80 to 90% of the stuff that they tested had a lot of stuff in it that didn't belong in there. They found DNA footprinting of a lot of just nonsensical weed from India and China in our vitamin supplement industry. And I urge your audience to go Google this article, because if you do that, you're going to look at the vitamin and supplement industry in a different light. So you asked me about this whole fad with these clinics that do IV vitamins. I mean, I'm not a proponent of it.
Okay.
You don't even know what you're having injected in your body.
Right. Yep.
And I can tell you that most legit doctors didn't go to med school to open a clinic to have IV supplements. That's not why we went to med school.
That's a fair that's a fair proposition. So what is the future? Where are we all headed now in terms of skincare?
Oh my God, I think we live in some really exciting times for the future of medicine, because medicine is heading towards individualized prescriptions for that person's genetic set of needs.
So precision health.
Correct. We're going to get there, and we're already there in some fields. For example, breast cancer, right? I mean, doctors do genetic testing of the genetic profile of your breast cancer to see what drug it may respond to better or not, right? We kind of at the beginnings of it, but there's going to come a time where we're going to know about exactly your genetic makeup in terms of how you're going to respond to a certain drug. And then we're going to be able to pick that drug, the ideal drug for that person's unique needs. For example, let's talk about high blood pressure. I know this is not my field, but I want to bring this message home because it's a very interesting message. We have a plethora of high blood pressure medications. Why is that? Because not everybody responds to those blood pressure medications.
Right.
Well, why is that? That has to do with our genetic makeup.
Right.
So some people respond to one class of blood pressure medication, some don't. Some need 2 classes of blood pressure medication, some need 3 classes. But right now, we're doing this by trial and error.
Right.
The doctor doesn't know which class of blood pressure medication you're going to respond to. They'll pick the most widely used class and they'll prescribe it to you.
Yeah.
What they do, come back to me a month or 2 later, let me check your blood pressure.
Yep.
Or check your blood pressure at home. What I'm suggesting is that in the future, that guess game in terms of the doctor's prescription process may be taken out. We may know much better from the beginning what drug we should be prescribing to you for your blood pressure, for your diabetes, for your cancer, based on your genetic profile of that particular cancer that you have. Because people think cancer is the same thing. It's not. A lot of different genes can go wrong in a cancer. So we're going to know what drug you're going to respond to better.
Amazing. I can't
And I
wait.
think that's going to be the future of skincare too, by the way.
I agree. I think that's 100% possible with the machines that we're doing. The cost of productions can go down. And that leads us into this whole idea of very customized, personalized skincare. I do want to talk about, or let me make this my last question, which is, what should we not be doing? Is there some cautionary tale that you want us to, focus on and say, please, men, do not do this?
Please don't go with fads.
Okay. Okay.
Please don't go with social media recommendations.
Okay.
It's funny. I was having this discussion with my daughter actually last night because we ate at a kind of trendy restaurant. And we kind of started discussing, why is it that you can't get reservations at certain restaurants in New York City?
Never.
They're booked for months and months. And so she says, that it's all the effect of social media, of creating a hype. That's all it is. And she's right. Why is it that some people get this hype and then you get... But the same hype goes through for a lot of things that we do in terms of skincare, in terms of fads, right?
Right.
One day it's exosomes. Next day it's salmon DNA.
Right. Yes.
Next day it's this.
Yeah.
The true thing is, what ends up having longevity
Yeah.
in medicine is what turns out not to be a fad. And
Right.
we've seen so many fads come and go in medicine for people who've practiced more than 20, 25 years like myself. So I caution people about just finding something on social media and going with fads. By the way, I'll say one last thing about social media. I have a lot of my colleagues even that get behind social media cameras and start putting their support behind a certain brand. I just caution people that these are all paid advertisements.
Oh.
And I believe that we should pass laws that when doctors recommend things, they should tell their audience if they've been paid for that, for what they're saying. And I think that we really need to pass regulations for that because, doctors are well-trusted spokesmen in our society. And we're supposed to present things scientifically and true and not necessarily what's the interest of a corporate entity. And unfortunately, social media is changing that. I'm not happy with what's happening. And so, you'll have plastic surgeons, dermatologists, other doctors get behind a social media camera and say, oh, I love this product. I use it. Well, do you really? Or is it that you just got
Paid for it.
paid for that and you're saying that? And I think that hopefully somebody even will listen to this and maybe we'll pass some regulations that will require doctors who put their support behind a product to tell their audience if they've been paid for that.
Yeah. I think there's some disclosure laws, but I think for medical profession, I agree, this has to be more stringent. But on a more fun note, we'll stop with the last question, which is, what is your skincare routine right now?
So I'm a very basic kind of guy.
Okay.
So maybe your audience will relate to me.
Yeah.
So I don't do a whole lot. I do moisturizers.
Okay.
I do use a cleanser with a acid in it, like once a day.
Once a day. Okay.
I do. It's very mild.
Okay.
Like a 1%, 2%. It's just very mild.
Like salicylic acid?
Exactly.
Okay.
Very mild.
Okay.
I'm a big proponent of Botox. Like I said, I
Okay.
do my own Botox injections regularly to myself in the mirror every 3 months.
Oh, wow.
So I'm a big fan of that.
Yeah.
I do get like a hydrofacial once in a while to keep my pores clean.
Okay.
And that's pretty much it. Kind of like I'm about the basics.
And what about retinoids and vitamin C or anything like that?
I'm not a big product person.
Okay.
And that has nothing to do with that I don't believe in these things. It just has to do with my personal laziness.
Okay.
So, I'm going to use just one thing. It's going to be a cleanser and a moisturizer. So if I was more motivated, I should be using those two things, but I don't.
Well, thank you for sharing that. And this was a fantastic session. I'm glad that you educated us on a lot of fun things. And I want to leave the audience with the main takeaway here, which is don't really go on fads, believe in the science, and think about all the various things Dr. Rokhsar educated us on today. And with that, I'll sign off.